come together to share information that is important to the in our work in service to the people of Oregon. First up, we have a presentation on building well-being together, and Joe Metlin is here to do that. If you are ready, Joe, the floor is yours.
Thank you so much, Sochi. Hi, everyone. My name is Joel Metlin. My pronouns are he, him, his. I work in the Director's Office of the Oregon Department of Human Services, and I have two other folks here with me today that I want to make sure to introduce as well. I'll turn that over first to Sunny Pettit.
Good afternoon, everybody. My name's Sunny Pettit, she, her pronouns, and I'm doing communications with the Building Wellbeing Together project. So here to just hear what people are saying and basically be here as someone who is listening and interacting. So I'm excited to hear what you have to say. I pass it over to Delilah.
Hello, everyone. So happy to be here. My name is Delilah, she, her pronouns. I work on Joel's team as the project support specialist. I'll be taking some notes today. And I wore green today for awareness for the homeless, runaway teens, supporting them. Yeah, anyways, thank you so much. Back to you, Joel.
Thank you, Delilah and Sunny. Hi, everyone. Very happy to be here. The topic for today is to just introduce some of the thinking that we've been doing here at the Oregon Department of Human Services about the future of our agency and our place in communities, and how we want to start showing up and supporting folks, and how that may differ from how we've done business in the past, or how we've been a part of people's lives. And so really, when we talk about what's called the Building Wellbeing Together initiative, it's the way we talk about what's the future of our agency, what do people want from us, and how might we need to change to be able to do what people want from us, the people that we serve, the communities that we support, just to make some time and space to ask the questions about what do people need from us, and how can we start showing up differently, and what do we need to change internally to how we operate to be able to do that. So the topic of today really is that future of our agency, and we've been reaching out to different folks within the agency, outside the agency, community groups, all sorts of folks to gather their thoughts to help us figure out what that future looks like. And that's why we're here today, is to hear your thoughts as well. So we have a very short presentation just to give you the context and sort of the basics of how we've been thinking about this. And then really we want to spend just we don't have a lot of time with you all today, so just spend some time hearing some of your initial reactions, and just open the door to you knowing that we exist, that we're thinking about this, and that you can connect with us and share more as we go along. This is that invitation for folks to connect with us in a variety of different ways, through forums like this, or directly as we go on this journey, because it's not a short journey to reimagine what an agency does and what it could be in the future. So let me share my screen, and then we will get right into it. The right one. Here's some questions for you all that we'll get to at the end, just so you can think about these as I briefly go through the other slides. But we're going to be doing, as part of this process, some strategic planning as an agency, so we can really have good discussions about where are we going in the next few years, what should our priorities be, what are the things that we need to change to get where we want to go. And for us to know that, we need to also know some things. What would you expect us to be prioritizing over the next coming years? What challenges are you facing, especially if you're working with DHS? What are those things that are important to you that we consider? And then what are those opportunities also that we don't want to miss, that may be coming up in the next few years, where we could really make some change happen and really have some good impacts on the people we serve and support? So those are basic questions, and we'll come back to those. And I know they're big questions. So again, we don't want to limit the answers to just this short period we have with you. That these are the questions we want to be asking over the next year or so, as we go through strategic planning, and be able to try to answer collectively. All right, so let me go back to the first slide here. So again, we're talking about today the what is human services, and that's what DHS does. What do those look like in, going forward in Oregon, and what's our department's role in that going forward? That's the big question. You know, our agency currently impacts up to 1.5 million people at a time across all our different programs and all the different services supports that we provide, whether that's cash assistance or services for people with disabilities, or it touches upon child safety. There's all these different ways that we're interacting with people on a daily basis. But the fact is that not everyone has equitable access to service supports. And then even with the supports that we have, sometimes they don't actually meet people's needs, or there's gaps where you know, a service or support isn't available in an area, or maybe there's no funding, or there is funding, but there's no workforce. There's all these ways that people aren't getting what they need. And especially if you take a look at this based on race or identity, age, or disability, you start to see that there's systemic problems where folks are just not getting the support that they need. And so when we talk about the future and building well-being together, we're saying we want to change that. We want to do something about that. We want to partner with folks and find solutions to close those gaps, and reduce the barriers that people are facing, especially due to race, identity, age, disability, or place. So we do have some work underway that falls within this idea of building well-being, of really focusing on people and trying to close those gaps and do something about some of the issues we're seeing. So we have numerous projects underway. They're looking for ways that we can get better at supporting people, whether that's just hearing more directly from them. Part of what we're doing here today is just building those channels for people to have conversations, to raise up the issues and barriers they're facing, or the opportunities, and for us to hear them, make sure that we're building our planning around those. There's also some work we're doing with other agencies that we recognize that the work we do, we can't do it in a silo if we're really going to be effective, because people interact with all sorts of different systems at the same time to help meet their needs. And the more those systems can be interconnected, the better. So for example, we don't, as an agency, even share data with any of the other agencies for the state. And it means that we are unaware a lot of the time if people are being served by different parts of the system, whether that's the employment department or the health authority or education. We silo everything off, even the data that we have, so we don't know when we're serving populations at the same time. We don't see how they move from one system to the other. And we really don't have that big picture of how effective are the things we're doing to try to help people. If we start sharing data, it creates the possibility that we could better understand the impact, and that we could figure out where we can make changes that would help address some of the issues folks face. Some other things that we're working on just quickly is we're currently putting forth our budget, our recommended budget for our agency for the next 2 years. And we've really thought that it'd be smart for us, if we want to be an agency that serves people better, that we need to build the ability to have feedback channels, have engagement opportunities. We need to invest in our ability of our agency to engage with communities and with our partners. And so that's some of the recommendations we're putting into our budget, or changes to our organization to help make that more possible. So these are examples of current work where we're trying to build out some of that infrastructure and make it easier for us in the long term to change and be more responsive to what folks need, and start addressing those gaps and barriers. So as we're doing some of these current projects, the big one that's on the horizon is, okay, we want to show up differently. We want to have space where we can really build out what we're doing, next steps for changing our agency. And we refer to that as strategic planning. And what we're going to do over the course of the next year is meet with folks, discuss all these gaps, barriers of feedback that we're getting, and then try to prioritize. Okay, we've heard a lot of things. We know that our agency is only capable of doing a couple of things. what are those couple of things that are going to be most impactful, that are feasible, and that we can really focus on in the next few years, so that we're not trying to do it all, but trying to do the things that we think are the most important and trying to get them across the finish line. In terms of that process, here's just a very general timeline. So we've been going out and asking people, what are those gaps, what are those barriers? We're compiling that information. That's going to lead into strategic planning over the next year. And it'll really help us figure out what changes we're making to the agency in terms of people, budget, culture, organizational structure, the partnerships that we may need in place with other organizations, community groups, et cetera, to be able to really fill in gaps, et cetera, over the long term, over the next coming years. So again, here's our questions to you all. I know I threw a lot at you, and trying to keep this short and sweet. But again, like, what would you expect us to be prioritizing over the next few years? What are those challenges that we need to address that are key to better supporting people and whole communities and whole families? And again, what are those opportunities? Maybe it's funding opportunities, maybe it's opportunities in sort of like momentum and change in different policy areas, whatever it is, what we should be aware of, that if it's going to be happening, that we want to make sure that we're coordinating as an agency and taking advantage of that and playing our role and bringing what we have to the table for those opportunities as well to make them more successful. So those are the basic questions, but also if you just have questions for us about any of this, about strategic planning, about us trying to figure out how to show up differently, we're happy to take those. And I'll just point out here that we have an email address as well for folks to connect with us. So you can feel free to share in the chat, raise your hand, share with us after this meeting. We're happy to take feedback, input, questions of any kind. It's part of our process. All right, so stop sharing and open it up for folks. Anyone have an immediate questions or thoughts that they were thinking about while we were talking that they'd like to share?
Hello there. My name is Trent Gay. I work at Central City Concern, and I'm a program manager. So one of the obstacles that I've seen, and I believe it's a pretty big barrier for self-sufficiency, it happens to come between SNAP recipients and TANF recipients when it comes to the training programs. So the TANF recipients, a lot of times our programs are set up for them to go into a Jobs Plus or something like that. But when it comes to really making the money at the CDL, driver's license, or in different areas where we're using snappable funds, even though these people are on SNAP, they're not considered on SNAP. We do have some other funds right now, but that's been a big barrier because we want to help the people. And so sometimes we have to figure out how to do that. But if it was built into the program that they could become eligible even if they were on TANF and be able to use the part of their food stamps, I think it's a lot easier transition for us to put them into one of the training programs that we have and be able to help them to become more self-sufficient with a job that will pay for everything: children, household, buy a home, all those things. And I think that the TANF looks at them as if they're really only capable of Jobs Plus and keeps them into a lower pay range, as opposed to just someone that would have been in one of our SNAP programs. And then we utilize some of the training and the step money and different things that they're not getting that. So
And thank you for sharing that. I think that's a good example of making sure that as we have chances to design programs or redesign them, that we're looking at what are those barriers we might be unintentionally creating that aren't allowing people to maximize the use of those programs for the trajectory of their lives. And I think that's a good example. Other thoughts that people might have?
Susan, I see you wrote in the chat. Do you want to follow that up with anything?
What do you want to know? On August the 8th, I showed up at the Riverside campus in Medford and tried to enroll 8 volleyball students with SNAP benefits. And they could do their first part of it by themselves. Then we got to the identity proofing, and that was a barrier. And then eventually they got the identity proofing thing done, and that took altogether from walking into the office to actually talking to somebody, took about an hour and a half. And then I knew that they were going to have to wait to talk to an eligibility worker who would eventually be able to get them their benefits. So I just assumed that would take a few days. They get to talk to somebody. And it was weeks later, I was at another college event, and I heard from the athletic director that the folks that I had helped on August the 8th still had not received their call from the eligibility worker, and I was aghast. And I was also aghast because that day we were supposed to have eligibility workers on all 3 campuses. That was one of our welcome days. I think that was September the 14th. And one worker showed up at one of the 3 campuses. So I feel like there's a lot of room for improvement here. For one thing, if DHS is going to promise, yeah, we're going to have an eligibility worker on all 3 campuses on your welcome day, we're going to do it. Let's see that done. And why is it taking this long? I don't even know if the volleyball students who had applied on August the 8th, whether they've received their benefits yet or not. I hear the wait time is like 8 weeks to get your call back. It's just a really good thing that we have the ability here at Rowe Community College to say, hey, we've got the food pantry over here. It's not going to supply you everything the SNAP benefits will give you, but there's some food for you here. There's something for you here. And we have excellent food pantries on 2 of the 3 campuses, but not the 3rd. So people are in downtown Medford have to figure out a way to get out here to Table Rock. Anyway, that's you invited me to talk, so there you go.
No, thank you, Susan. I think that's really important to hear. And that's unfortunate to hear too, right? That's a terrible situation for folks to be put in, and it's put more stress on other parts of the system that are providing food support, right? When folks can't access the SNAP benefits in a timely manner. And we'll definitely be sharing this feedback with the various parts of the agency that are responsible for various pieces of this. You know, one of the pieces of work that's underway right now is building a new eligibility workload model. It's basically how do we staff things like eligibility for these various programs, and eligibility for us has changed pretty dramatically over the last few years, and we need a workload model that makes sure that we have enough staff doing all the different work that's required to make sure that we can handle the workload, because it's totally different than we've had before. That work's happening right now, and as part of will inform the budget for the next biennium, which will impact our ability to hire and fill positions and complete that work. So this is not this is a very critical thing that we have to have in place in the next few years, is making sure that we're getting funded for and have positions to do the work that is critical to what people need from us on a daily basis. So it's not a small thing, and I really appreciate you sharing the feedback and the experience that people are having right now. I think it's incredibly important for us all to hear. I see another hand up. Is it Farron?
Yes, hi Joel, thank you. Like Susan, I am one of the 24 benefits navigators that are now employed across the 17 community colleges and 7 four-year colleges and universities across Oregon, based on the passage of Oregon House Bill 2835 last year, which recognizes a crisis of basic needs and security among college students. that is contributing to some of the highest dropout rates and lowest initial enrollment rates at colleges and universities that has been seen since the Great Depression. And so the concept behind our position is to connect students who express a need with resources for that need in hopes that they will be more likely to retain at our colleges. And in 8 months now, almost 9 of doing this work, I have really come to realize that the initial conceptualization that the legislature had for our position is quite different from what it feels like on the ground, because I think their initial conceptualization was that as long as we connected students with ODHS benefits successfully, that those students would have their needs met and everything would be fine. However, I'm finding that's absolutely not the case for a number of reasons. Firstly being, I think we all need to recognize at all agencies inside and outside of colleges, we are reaching a place in which a family or person or household can have an income that exceeds income maximums for benefit structures like SNAP. But because of things like outrageous increases in rent rates, they may be making more than that maximum, but half or more of their income is going to rent, which is considered extremely rent burdened. Anything more than 30% of a monthly income going to rent is considered rent burdened, and more than 50% is extremely rent burdened, which is a form of serious housing insecurity. And so I have a lot of students that, because they still have a partner or family member in the household who is earning an income, although typically at a fairly low hourly wage, and they may still be working part-time while they are going to school full-time, their family income or household income exceeds for qualifications for a lot of help, but they are still struggling pretty extremely. There are also some issues coming up with especially SNAP, which Susan mentioned a couple minutes ago. But also one that I am seeing is that I believe there's some issues that need to be addressed among eligibility workers, potentially not understanding how to properly process college students' SNAP applications in terms of how financial aid and work study employment and things like that are counted in income and resources available, especially considering the fact that many students have to adjust their work schedule every single term to adapt to what their new class schedule is. And so they can gain and lose eligibility really rapidly, because if they increase their work hours just a little bit coming into a new term with a new class schedule, they can, if they are honest about their change in income, can suddenly lose their SNAP. We also have programs like STEP, SNAP Training and Employment Program, that if a student loses their SNAP eligibility, they are also losing additional supports that they receive through STEP, which can absolutely be the difference between staying in college and not being able to come to college anymore, which of course is impacting broadly society, in that if college students can't afford to gain new certifications and degrees and go out into society and take important jobs that we need for our communities to function, that's a concern for everybody in and outside of colleges. Lastly, I'm sorry to be taking up so much time. I'm really concerned about the policy that currently exists, in which students under the age of 22 who still live in their parents' household can never apply for SNAP separately from their parents. I think that it is a really poor assumption that a 21-year-old student whose parents are still allowing them to live at home are also still willing to feed their young adult. There are plenty of young adults whose parents are essentially saying, yeah, okay, you can live at home because rent is outrageous, but you're on your own for feeding yourself. And that doesn't always turn out well when that student is trying not to work full time while they're also a student, and then also cannot apply for SNAP independently. I think that we maybe need to be considering that young adults can live at home without actually being a full dependent of their parents, that they are being given a roof over their head and that's really it. And they may actually be paying their parents' rent and utilities while they're living there as well.
Mhm.
And it's leading to a ton of students having to rely on food banks and college resources that we have cobbled together to try to help with food insecurity. My college specifically, I'm at Lynn Benton Community College. Our college specifically does not currently have a food pantry. We do have a small grocery gift card program. And last school year, the budget for that program for the year was supposed to be $5,000, and we ended up spending $12,000 because there's such a level of food insecurity. This year, we have budgeted about $15,000, and in the first 2 weeks of fall term, we used $2,500 of that, giving out grocery gift cards. So the level of food need is pretty immense, and I'm glad that we just saw a SNAP cost of living increase to benefits, but let's be real, 12% does not match what we've seen happen to our grocery prices over the last couple of years. 30 or 40% probably would have been more realistic. So people are getting more dollars, but their spending power has not necessarily increased in parallel. And I would argue that our societal expectation that college students just survive on ramen while they're doing the most challenging learning they have done so far in their lives is a really bad idea. Ramen is not brain food. And if we're going to ask students to spend thousands of dollars to learn very difficult things and remember them and be able to apply them in the future to jobs, they probably need to be nurturing themselves better than ramen in order for their brains to be operating in a way that can retain that information and those skills. And so I think that our over 200,000 public college students that us 24 benefits navigators represent are a huge demographic in Oregon. That's just public college student numbers, by the way. I'm looking at another screen right now that tells me this year's enrollment's about 206,000 across our community colleges and public four-year colleges in Oregon. So essentially a city larger than that of Salem, a population of college students who are a demographic we're not serving very well with DHS supports. And I didn't even get started on ERDC, but I'm hoping we'll talk about that later on in terms of policy improvements. I'm in a hush now. Thank you for listening.
Farron, thank you so much for speaking. And I thought you had a hand up as well, but we're going to make a transition. Joel, you want to say a few things though before?
No, I do want to I really appreciate this, because this is getting down to the level of some of the things that we talk about as changing the way we do business. Folks focus a lot on things like navigation that we just got to help people get better access to. But if the benefit itself isn't meeting the need, then we need to look at the program design and the benefits levels and be working on all those different changes wherever we can, and advocating up when it's not within our control to the federal government and whoever else to make changes. So I appreciate hearing all this. This is great. This is exactly the kind of feedback that we need. So please do connect with us, and we'll provide more opportunities like this in the future as we move into strategic planning to have more in-depth conversations. But I think you all have such great feedback for us, and I really appreciate even the little bit of time we have here today. Thank you again. We're going to copy down the meeting chats as well, so we make sure to capture all of that. Thank you again, and thank you, James, for the time on the agenda.
Yeah, Joel, we'll have to have you back, because this was a great discussion, and Farron, you don't have to apologize for your long-windedness. We need to hear these types of things, definitely. And part of the reason I'm happy about, well, I'm not happy, but it's good to make the transitions. We have our SSP policy teams here to talk about some of the changes that are coming up, and I invite you to ask questions to them as well. And so this was a great discussion. So thank you very much. But I'm going to hand it over to Jen Harass with our childcare team, because as Farron, you noted when you first came on, we do have some announcements to make about policies coming soon. Jen, yeah, there you are.
Yeah. Hi, everyone. We have a lot of announcements for the ERDC program. So coming, I'll just jump straight into it. I know I probably don't have a whole lot of time, but coming January 1st, we're going to have one of the bigger changes, and it sounds like it's going to be really important to this group, is that the employment-related daycare program will no longer will no longer require students to be employed in order to qualify. So our student eligibility is expanding to non-working students as well. The previous policy said that as long as someone qualified for employment hours, we could add on student hours. There were still some limitations to that. We wouldn't pay for more than full-time. So if someone was working full-time and going to school, we couldn't cover it. But those are all changing effective January 1. So we'll be able to cover non-working students. We're also going to be adding on additional study time for students. So there'll be between 5 or 10 hours a week based on the student's enrollment in class. And that will be automatically added on to the students' class hours. And then some of the other changes for students that we're making is particular for students who are age 20 and younger, who are attending a local high school or GED program. Currently with the student requirement, we say that students have to be attending a school that's eligible to receive federal financial aid. And that's just a requirement that we've had. The ERDC program also has a few contracted or childcare contracts for high school students who are attending high school or and completing those that coursework at their local schools, but we only contract with about 29 school districts across the state. So come January 1, the standard ERDC program will allow these parenting students who are 20 or younger to still continue to go to their local high school or GED program, and it doesn't have that restriction for the federal financial aid piece for that group. The 20 and under, that's really to align with Department of Education and when students can be attending high school. Let me see, what are some of the other changes that are pretty exciting. We're moving how we authorize hours. So previously what we did with hours is if someone was working 7 hours a week and they showed they're working 7 hours a week, that's what we would approve. But now what we're doing is we're moving to a part-time or full-time authorization of hours. So anyone who is working or going to school between 1 and 20 hours a week will get that full 20 hours a week. We add travel time onto that as well. And then anyone who is working or going to school between 21 to 40 hours a week will be authorized the 40 hours a week. Our travel time is about 25%. And so what we would actually see is 25 hours a week and 50 hours a week is what would be approved. As always with the ERDC program, we can authorize extra hours as well. So if people are full-time employed and going to school, they'll be able to qualify for our maximum is 75 hours a week. So that's 323 hours a month. That's a lot of time for parents to be doing things and for kiddos to be in childcare. But that is something that's allowable for various reasons. So it's not just for going to school. It could also be for working overtime, extraordinarily long commute times where they just need extra time to get there. And also with people who maybe don't have a car and they have to walk to work or ride a bike to work and it takes them longer. Some of the other changes that we have are changes to authorize medical leave. So when someone is currently on leave from employment due to their own medical condition, we can maintain their ERDC up to about 3 months past the end of their certification period. And the changes that we're making to this, we're really expanding it. So it's not just for the parent. If they have something going on, they can also go on authorized medical leave now if they need to care for a child that's in their ERDC group. And then we're expanding that also so that when people first apply for ERDC, if they happen to be on medical leave, they'll be able to qualify as well. Previously, they had to be eligible for ERDC to get the leave. So this is going to be a little bit different. And then we're expanding, I don't know that the name really matches up so well, but it's our authorized work search period. That's typically when someone's off work due to like a layoff or if for some other reason they lost their employment, temporary job ends, we would give them authorized work search. But we expanded this coverage to allow if someone is on leave from employment in order to care for someone who's not in their ERDC group. So this could be a family member who's fallen ill that they need to go take care of, as long as they're on medical leave from their employment. We have a few different reasons in the drop down in the one system that will trigger this, but it would allow them to maintain their ERDC for that period as well. The authorized work search, they do have to be eligible for ERDC first. So that one's a little bit different. And the other piece we have is that we were able to lift one of the restrictions for sleep time. We can give sleep time to parents who work night shifts, and they need that extra time to both, they need childcare for both their employment and for getting some rest. We had a restriction that we couldn't allow sleep time for 2-parent households, and so that restriction is being lifted as well. So we just finished up with 4 different Q&A sessions with some of our eligibility staff across the state. I think we reached about 800 total. And I have to say, they're very excited about the changes. Luckily, a lot of the changes are going to be built into the one system, and so we don't have a whole lot of extra things that they have to do. But one of the biggest questions they had is, how are we telling community partners and how are we letting them know about the changes? And so this is one of the platforms. We're also planning a media release that should be, we're planning it in conjunction with the Department of Education Early Learning Division. So that should be issued out, I believe, in the beginning of January. And then we're working on mailings for both the current ERDC families as well as childcare providers to let them know what changes are coming. And we're going to be working with the SNAP program as well to see if we can identify families who may qualify that just haven't applied, and send out a recruitment letter to SNAP families that look like they may be eligible for the program as well. So that's all the January 1 changes in a nutshell. I don't know how much time we have for questions, but I love answering questions. So if you guys have any, I'm here.
There's one in the chat, and I just want to mention, this meeting's recorded, and we'll have notes too, because that was a lot. So Beth asks, how is DHS defining medical leave? What medical leave is authorized?
Basically, let's see. So we've got parental leave that we're allowing for after the birth of a child. That is the kind of the one caveat where we don't require medical documentation, but typically we ask for medical documentation. And medical leave is really if they're unable to work due to a medical condition. And I mean, that just as long as we have verification from a medical professional saying that they're unable to work and when they'll be able to come back to work, we enter that in as the medical period. If they don't have a prognosis or when they'll be able to return back to work, we do tend to use, like, if they have a check-in with the doctor in 3 months, we'll use that date and then just get additional verification later.
And Beth, no?
Sorry, could you just clarify, do you have to have work to return to? Usually leave means you're still employed, but you're off work because of an injury, but some people will be injured and not not have work to go back to, and not have sanctioned by their employer to leave and come back, but they're injured.
If they're first applying for benefits, we do say that they have to be on medical leave from current employment. If they're on ERDC and they've had to take leave, we know a lot of times that this could lead to them losing their employment, and we'll keep them on medical leave. If they're released from medical leave but they don't have employment, then we switch it over to that authorized work search period, because now they've lost their employment. So it gets a little bit complicated, but we have a few different ways that we can help support families when they're going through basically the trauma of not being able to work and or losing their job at the same time.
And if someone doesn't have insurance, so they don't have ready access to a doctor?
We do still have the requirement for the medical documentation. So, I mean, it could come from a free clinic. We don't say who necessarily it has to be that gives that medical documentation, apart from them just being a medical professional. And it has to line up with the with the issue. So for example, like if I'm having issues with my vision, I can't go to a podiatrist and get a letter from them. It needs to line up with the reason for the leave.
Cool. Well,
Can
and-
I ask
Oh,
one quick clarifying
sure.
question? And Jennifer, it's still the case that the parents themselves don't need to have the immigration status to get, they would need to get SNAP for themselves, for example, just their kid or at least one child would need to have qualifying status. Is that right?
Right. We only look at the eligibility for the children at this point in time. I'll put that caveat in there, but that's for a future conversation. And also with ERDC, we don't have a requirement for the caretaker to be related to the child. They just have to have care and control of the child. And so we do have a lot of situations where, you know, it's not grandma or aunt that's caring for a child, it's the neighbor, or, you know, your child's best friend came and never left Sunday. And as long as they're the ones who are essentially in what we call care and control of the child, so making sure they're going to school, making sure they're eating meals, then they can apply for childcare for that child as well.
And is there no wait list, right? Like this is a well-funded program right now. Like we're not putting people on wait lists.
We don't have a wait list at this time, and with our funding, we look like we're pretty solid for at least for this biennium. I think that's as far out as I can speak to it.
And I'm hoping to move on soon, but Christina, do you have a question?
Yeah, is there a way you guys can put information on your outreach, or I don't know, the community member always thinks that when they apply for any support, whether it's childcare or food stamps or any services that is public charge, or that they're going to be deported, or, you know, they're always afraid of things like that. Is there information for them to take and note that if they apply for this funding, that the immigration status is not in jeopardy, or it won't affect their path to citizenship in the future? Thank you.
That is a really good point. We can definitely take a look at our public facing websites to make sure that that information is more prominent, or I'm not even sure if it is noted on there, but I think you're right. We do need to be pretty clear and note that pretty prominently on the public facing website. So we can definitely take that back and take action on it.
I strongly support
Yeah.
Christina's point on that. And I would also, I feel a little bit bad saying this in a public meeting, but when I go to if I Google Oregon employment related daycare, I go to the Oregon website, and it's got ERDC information right on the front in English. But if I click on Spanish, there's no ERDC information at all. Like it just doesn't have it. It's not the same as the English. So there's a bit of a disconnect, but truly what Christina said is our experience is also for our clients. It's so important to have every time you're talking about anything that is money from the state, just have a quick one sentence, and feel free to link to Oregon Law Center and Oregon Health Authority have a public charge fact sheet that also you could link to, but people need reassurance, it's for sure.
Yeah, I worked as a case manager for years and worked a bilingual caseload, and that was most definitely one of the concerns that my families always had kind of when they were coming through.
Great. Well, thank you. This is a very helpful discussion. Move over to Vicki with TANF. You have some quick updates.
I do. Hello, Vicki Partridge Highland with the TANF policy team. I wanted to share that our winter non-recurrent short-term payment for clothing for children is expected to go out on or around November 15th. This is for families that qualified for TANF in September of this year. So that's expected to go out. And then I also wanted to let everyone know that we are aware that there's been some TANF families affected by skimming, cloning of their EBT card, and that is where the families lose their benefits because the person that cloned it or skimmed it has accessed the benefits prior to our families being able to access their TANF benefits. And so we have sent communication out to our staff explaining steps to take, and then communication of what families can do to help protect themselves. And just to update for that, we're looking at changing the Oregon administrative rule of how benefits can be replaced for TANF families if they are affected by something like this. Currently, we can't replace the benefits, but in January, hopefully the rule will go through and we will be able to replace. What we are recommending though is if a family is affected currently and their jobs eligible, so they're eligible for our jobs program and eligible for job support services, that they reach out to their family coach talks with them about maybe utilizing jobs funds to help meet some of their needs. So that was my update.
Thank you for that, Vicki. Yeah, the card scamming and skimming is something that we need to make sure people know about. And turning over to Lucy with our SNAP team.
Hey, good afternoon. I'll be brief because I believe we want to talk about PEBT also, and that's Stephanie. So just to follow up with what Vicki was sharing, with the SNAP replacement, that's also something we're not allowed to use federal funds to replace SNAP benefits if someone loses their, if someone is a victim of stolen benefits through skimming or a scam on their EBT card. So that's something we're looking at some federal advocacy and seeing what, paths forward for solutions to help people that are impacted by that. My other quick thing that I wanted to plug is we are still doing emergency allotments. We are issuing them for November. We will be applying for December. Because we've been approved for November, we can do November and December emergency allotments, but we're continuing to apply in alignment with the public health emergency, which I believe we only know is through January at this time. So we will be updating folks as we know more about that.
Sorry for all the information. Beth, you have something?
Yeah, are you advising people to get new Oregon Trail cards like every time that happens? And how are you staffing up on that, the EBT replacement team? I didn't realize this was such a big problem. I'm totally horrified. There's people who their food money just disappeared, and there's apparently, it sounds like there's no recourse right now.
I'm not the best technical expert, Beth, but I'll give it a shot. My name is Heather Miles. I'm the SNAP program manager. I use she, her pronouns. What we're doing with this one is really looking at the different ways our EBT vendor can also help support some of the fraudulent activity that's happening through this. There's a way that we can have them put a hold on the card and break that connection. It doesn't mean that that individual needs a new card. This is the hard part. If it's something that's been cloned, it means that their card wasn't actually present at the time that that fraud took place. So we are encouraging people to, again, report the fraud. Report the fraud definitely to law enforcement, making certain that we follow every track that we can through that process. When it comes to replacement cards, when it's a replacement, we have a centralized replacement EBT team that works on requests for PBT or for EBT cards to be replaced. We also have the ability within our storefront offices that if somebody is in an emergent need and would like to replace a card more quickly than that, they can go to a storefront office and make that request. Because we know that this is something that is ultimately a really emergent need for that individual. As Lucy mentioned, at the moment, from the SNAP program federally, they don't allow us to replace benefits that are taken fraudulently from the case. That is something that is being discussed at the national level on a more elevated manner. This is a national issue. It also goes beyond EBT benefits as well. This is a kind of activity that's happening at merchants that can affect Visa cards, MasterCards, just people using electronic cards in general. And so there is a heightened level of awareness to try to address this differently than what we're currently able to do.
And Heather, why don't you,
Made the transition to PEBT.
yeah, and we have there's a question about sharing plans about PEBT too.
Just to address that, Claire, we do have plans to do this, public facing communications to go out. We're working with our communications team right now on getting a fuller picture out to everybody, but we have successfully deployed the childcare plans for PEBT this last month. In October, we sent benefits out to over 80,000 children who are under the age of 6 on the SNAP program. We will be doing a final catch-up payment for those individuals that, for whatever reason, payment didn't go out correctly. That will go out in December, and that will wrap up that program year. I know folks on this call had questions previously about why we did that particular program and not the broader one. And that really, I think, was explained about being just more of a technical, a federally technical challenge than what we were able to meet at the time, especially with some of our schools not having the level of information needed. But what happened with that childcare plan, it made us eligible to be able to apply for the summer pandemic EBT program, which is what Oregon was able to do, and we were able to get approval for that plan. We're working through with our systems teams and our other teams how we will deliver those services, and at the moment we are looking at those benefits going to families in spring of 2023. It will be a one-time payment for families. We're looking at that being about 434,000 children that will be able to reach through that program. And the total one-time food issuance will be $391 per child. That's as high level as I could make it, James.
I put you in a tough spot, Heather. I appreciate that.
Right. You have 2 minutes.
How about that? I even warned people we might go over, but are any comments or questions? Like I said earlier, the recording will be available next week, as will the notes. And I want to also thank Carol, who's doing our ASL interpretation, and Elisa, who is doing the captioning, if you've been following that as well. So thank you for coming, and please, let's not end the conversation here. We'll keep it going, and next time I might even introduce myself at the beginning as James Barta doing community engagement. So thank you all.
Thank you.